Welcome to the deep dive. Today we're taking your sources on menstrual health, and we're really trying to define the spectrum, to move beyond just personal experience and into actual clinical benchmarks.
And we should just jump right in, because this isn't just personal health. I mean, clinicians often call the menstrual cycle the fifth vital sign.
The fifth vital sign? Why is that?
Because its regularity, its consistency, is a direct window into your overall metabolic and systemic health. It tells us so much.
That consistency piece is huge. We saw in the research this really clear link where persistent irregularity, we're talking cycles over 40 days, it's not just a fertility issue.
Not at all.
It's directly tied to an increased risk of really serious chronic conditions, things like coronary heart disease and even type 2 diabetes. It elevates the stakes immediately.
It absolutely does. And that cardiovascular link you mentioned, it's often rooted in the chronic inflammation that comes with that kind of irregularity. So, okay, if regularity is the key metric, what are the objective boundaries of normal? You know, what we call eumenorrhea.
Yeah, what are the numbers we should actually be looking for?
Okay, so for timing, the baseline for a healthy cycle is in a pretty tight range. It's from 21 days up to 35 days.
21 to 35.
Right. And if you're consistently shorter than 21 days, that's polymenorrhea. That can signal things like premature ovarian aging or even just high chronic stress.
And on the other end?
On the other end, if your cycles are consistently longer than 37 days, that's oligomenorrhea, and that often points toward issues with ovulation.
Okay, so we've got the timing down. But what about volume? The sources mention a clinical threshold of 80 milliliters of blood loss. But, I mean, how can anyone possibly know if they've crossed that line at home?
You can't. It's impossible.
Yeah.
So we have to rely entirely on functional criteria for what we call heavy menstrual bleeding, or HMB.
This is about how it affects your life.
Exactly. The diagnosis happens when the blood loss interferes with your life. The critical red flags, the things you need to track, are soaking through one or more pads or tampons every hour for several hours in a row.
Wow, every hour.
Or if you consistently have to get up during the night to change your sanitary protection. In the clinic, the real question we ask is, are you canceling plans because of your flow? That's the true diagnostic line.
This is where it gets really interesting for me. What I found so surprising is how often the cause of a cycle disruption is completely external to the reproductive system itself. Like when the rhythm just shuts down amenorrhea, right? No period for 90 days or more. It points to a disruption of the HPO axis. Can you break that down for us?
Yeah, the hypothalamic pituitary ovarian axis.
Yeah.
It's this complex hormonal feedback loop.
Yeah.
And when it gets disrupted, it's serious. The body can stop producing really necessary protective hormones, which can lead to systemic issues like rapid bone density loss.
And what causes that disruption?
Well, major causes are endocrine issues like PCOS, polycystic ovary syndrome, which is very common, and also thyroid malfunction.
And that's both an underactive and an overactive thyroid, right?
Both, yes. They can cause all sorts of menstrual irregularities. And then there's the role of weight, which is just crucial.
Right. Both excessively low body weight, but also being overweight or obese.
It's a huge factor. That excess weight can lead to insulin resistance, which has a direct impact on the HPO axis and can lead to those irregular anovulatory cycles. It's a metabolic domino effect.
Okay, let's pivot to pain. Dysmenorrhea.
So with pain, we really distinguish between two types. First, there's primary dysmenorrhea. These are your, let's say, standard physiological cramps caused by prostaglandins. They usually respond pretty well to NSAIDs.
And then there's secondary dysmenorrhea, which is the major red flag. This isn't just bad cramps. This is pain with an underlying structural cause.
Precisely. We're talking about diseases like endometriosis or fibroids.
Yeah.
And because these can be so hard to diagnose, the critical clue for you, the listener, is the pattern of the pain.
What kind of pattern?
Severe, rapidly worsening cramps over several months, or, and this is key pain that persists outside of your normal menstrual phase, if you're hurting even when you're not bleeding, that is a sign that absolutely requires a systematic investigation.
So, bringing this all together, what does this all mean for someone listening?
It means understanding these clinical benchmarks, that 35-day limit, the hourly soaking. This is your key to advocating for yourself effectively. You have to move past just saying you have bad periods.
You need to bring data.
Yes. The imperative for detailed tracking, I just can't overstate it. Tracking establishes your own stable personal normal. And that allows you to recognize when a deviation crosses one of these clinical thresholds.
And to spot other signs, like anemia.
Exactly. things like chronic fatigue or shortness of breath, you use that objective data, the timing, the volume, the persistence of the pain, to demand a systematic medical investigation.
So don't let your self-defined normal mask a real structural issue. Use these benchmarks to get the care you need.